Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Preventing pressure ulcers. Introduction. Pressure ulcers are very common in patients with limited mobility. They can be very difficult to treat and could get infected. In rare instances, infected pressure ulcers could spread the infection to the rest of the body and lead to death.
Preventing pressure ulcers is much easier than treating them. This program will explain pressure ulcers and how to prevent them.
Pressure ulcers. Pressure ulcers occur when an area of skin dies because of the pressure exerted on it. For example, if a patient lies on his back without moving for an extended period of time, the skin of the lower back is put under continuous pressure. This pressure cuts off the oxygen to the skin. If the pressure is not relieved, the area of skin starts to die. When the skin breaks down, an ulcer develops. The ulcer can be very deep, involving underlying muscle and bone. If not treated promptly, surgery may be needed to clean the area. If the infection spreads to the rest of the body, the patient's life may be at risk. Pressure ulcers are most likely to develop in the following areas: heels, coccyx, sacrum, hips, ankles, and any other area of skin under pressure for a long time. In some cases, it may take less than 1 hour for a pressure ulcer to develop. Risk factors. Some patients are at a higher risk of developing pressure ulcers. This section discusses risk factors that can increase a patient's risk of developing pressure ulcers and can also make the ulcers more difficult to treat. Patients who are confined to a bed or chair for extended periods of time, such as those suffering from head injuries, spinal injuries, or paralysis, are more likely to develop pressure ulcers. Obese patients and patients that have diabetes or heart problems are also more likely to develop pressure ulcers. Other conditions that increase the risk of developing pressure ulcers include incontinence of urine or stools, malnutrition, poor circulation, decreased sensitivity.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Preventing pressure ulcers. The most effective ways to prevent pressure ulcers is to minimize pressure on the skin and to treat any underlying medical condition that increases the risk of pressure ulcers. Patients able to walk should be encouraged to do so a few times a day, even if it means having someone monitor them while they walk. Patients able to shift their positions in a bed or wheelchair should do so as often as once an hour. For patients that cannot change their position on their own, nurses or family members can reposition the patient every 2 hours, more often if the patient is uncomfortable. They should also frequently check the patient's skin for the earliest signs of pressure ulcers. The use of special mattresses, such as air mattresses, can help. Pillows can be placed between the legs to prevent the inner parts of the knees or ankles from rubbing against each other. For patients who are incontinent of urine, special pads can be used to absorb the fluid and keep the patient's body dry. A moisture barrier should also be used. Patients who are incontinent of stool should be checked frequently and cleaned quickly and thoroughly. A moisture barrier should also be used. Donut-shaped cushions should not be used as they can decrease blood flow and worsen pressure ulcers. While in the hospital, your nutrition status will be monitored to assure adequate nutrition to prevent pressure ulcers from forming or to heal ones that are already present. If you feel that a pressure ulcer is in an early stage, make sure to tell the healthcare providers. Treating pressure ulcers early helps prevent further complications.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pressure ulcers can be very hard to treat. Preventing them is possible using some very simple yet effective methods, such as walking when possible, shifting positions in the bed or wheelchair, repositioning the patient frequently, using special mattresses, placing pillows between the legs. Feel free to ask the nurse or doctor about the measures they take to prevent pressure ulcers.
Thank you for using Explain.